Hello and welcome to this special show on Rajya Sabha Television. I am Vishal Dahiya, and here we bring you all the aspects of India's fight against COVID-19, mostly the digital aspects as to digital interventions, what we have learned in terms of harnessing digital technologies in not only the fight against coronavirus, but also trying to go ahead and improve the way we do things in several aspects of our life. So today we will take a look at the health system, the public health system, and we'll try and understand how we can further go ahead and ensure that the digital health ecosystem can be formed or can be put in place very effectively, not only to combat pandemics like this, but also to deal with day-to-day health needs of the citizens of this country. So let me first introduce the guests. We have with us three of them. Let me begin with Ms. Sheetal Ranganathan. She's a consultant and author, writes on varied topics and specifically on public health and obviously the use of digital technology as well. We also have with us Dr. K.R. Murali Mohan. He's the director of ICPS, an organization with the Ministry of Science and Technology. Once again, quick focus on what all digital technologies are there and how they can be harnessed. We also have with us from Niti Aayog, their public policy specialist, Ms. Urvashi Prasad. Welcome all of you to Rajya Sabha TV studios. And let me begin with you, Ms. Ranganathan. Let's try and understand, this particular crisis. We have had a lot of difficulties and we have tried to overcome all of them as well. The fight still continues. But what is it that, according to you, we have learned in terms of the amalgamation of technology vis-a-vis our public health policy specifically?
Yeah, good evening, everyone. Thanks for having me. Worldwide, it is being said that the COVID-19 epidemic has actually revealed the fault lines in health systems in various countries. And I think it makes sense to say that for countries which were known to have very solid health systems in the Western world, but India really didn't need a COVID-19 epidemic to be aware of the fault lines. So it already had a compelling case to adopt digital health solutions and pronto to bring a tangible and significant change to lives of people within the finite resources that we have on the health side. What COVID-19 has done, and I am just hoping, and Urvashi is there from Niti Aayog, that it brings an urgent focus on digital health because of so let's say for one of the biggest health challenges for India is of accessibility, which is not just because of income inequity, but also because there is a severe shortage of health workers, doctors, nurses, technicians, primary and secondary healthcare centers, because of which a significant chunk, actually more than half of our population, is left underserved or not served at all. And the mystery of this stares in our faces every time when we go past AIIMS or Safdarjung Hospital, where people have come from far-flung and deep interiors of India to see a specialist for less than 10 minutes. So going hungry, emotionally broken, living in dehumanized conditions, somehow clinging to life on a very tenable string of hope. And not to forget the physical and mental stress on health workers, doctors and nurses who are overwhelmed by serving these crowds, which is beyond capacity. So it also puts a huge risk on health outcomes and the quality of care. So it's extremely important for us to hand digital tools in the hands of our health workers, to ease stress at their job by giving them, say, for example, support of clinical decision making to be more effective. Tech can actually act as a knowledgeable intern, or to supplement district health centers and small and medium private clinics in far-flung places or underserved places with enhanced capabilities through telehealth, which will allow virtual access of specialists. And this would mean that we can increase our access by remote care to low-income patients, and also to people who are medically underserved in areas because of tyranny of distance. Also the very elderly and very sick patients who can't really have the capacity or the luxury to come to a tertiary care hospital or even a primary healthcare clinic. So there is a huge opportunity to amalgamate tech with healthcare, and it has already triggered a knee-jerk reaction. It is unfortunate that it needed a COVID-19 to do so, but I hope this continues and this is taken on a war footing now.
Okay, but there's a silver lining beyond every cloud as well, and that seems to be the silver lining there. Let me bring Dr. Murli Mohan here. In terms of that amalgamation, which Sheetal was talking about, and the way we've seen as well, what kind of technologies have we been able to harness as far as the health ecosystem is concerned in the past 4 to 5 weeks during this, fight against COVID-19?
Yeah, great. Thanks for inviting me for these discussions. Now let us see the entire governance system, what we are having at present. So at either at the state level or at the district level or at the primary health centers, they're all very strong, what you call, these health infrastructure and a very strong governance system. Mm-hmm. Now, when we'll have this type of epidemics, all these health systems availability at the district level or at the health delivery system, it will be overwhelmed. That's what is happening here. That's what is happening across the globe also. Now, how these the technologies can be brought in? What are those technologies? How we can bridge a gap between the doctors and as well as the patients? That is what the digital technologies has to come into picture. Now, when you talk about the technologies, at first one is we need to have a strong geographical information system, because epidemics spread very fast. The rate at which it is spreading, the area at which it is propagating, and identification and quarantining of all these areas, we require we have a strong geographical information system. That's number one. And number two is how we can bring the sensing technology or the sensors, whatever the testing equipments what we are having, or the equipments which we use for estimating number of the contacts available in the entire in the country. We need to we have our sensing technology. The sensing technology will give us the number of patients who are getting contaminated with these type of viruses, and how and the area coupled with the GIS will give a clear picture what and where it is happening. Okay. Now, apart from that, we are trying to bring in what we call AI-based technology platform, where the machines can learn from the patterns that's happening in the ground, and then give us a type of information system that what could be the possible scenarios, how we can mitigate them, and what are the supply chain management systems has to be made, so that we can minimize the entire the infrastructure.
Okay.
So this technology platform creation, partly we have already done it. The Minister of Information Technology NITI already rolled out one product. The Science and Technology Minister of Science and Technology is also planning to another 1 week we'll have an AI-based technology platform. And GIS is already in place. So integrating all this technology, giving a single interface is what is our ultimate objective. Remember, the governance system is one, and enabling those governance systems through the science and technology is our entire objective.
Okay, let me bring in Ms. Prasad here from Niti Aayog, and looking at it from a policy point of view, Mr. Urvashi Prasad, both what Mr. Ranganathan is saying and Dr. Mohan pointing out these various tech platforms, how better these can be integrated further, because there is indeed a stress, as Mr. Ranganathan pointed out, on both sides, on the health workers as well as on the patients which need to be served. They need more resources, as in terms of health workers, and the patients need more care.
Yeah, absolutely. I think on the digital side, I think one of our biggest challenges has actually been integrating and bringing together data that we get from different systems across the public and private sectors. We have a lot of different, data systems which collect information about different diseases, but there's a big challenge in integrating all of this. So that's one part of the effort that at least Niti Aayog has been involved with, that how do we create a common, consistent digital health architecture where everyone's using the same vocabulary, we're using the same terminology, and the data can really be shared, integrated, and is interoperable, because I think that's one of the most fundamental challenges for us. And it also holds back policy making actually to a big extent, because you cannot really, always get access to the kind of timely data that you need to make the decisions that you need to make, whether it's, during a pandemic or even otherwise. If we don't have access to this data, it's very difficult to make the right kinds of decisions. So I think that is one big effort that, at least Niti Aayog and a lot of other stakeholders in the government have been involved with. And hopefully this will get, a fillip through something like this. It is unfortunate. But, I guess we've also realized that, these kind of enablers, digital health technology are really crucial at a time like this. The other quick point that I would make on, digital and technology is also on the research side. I think it's become very apparent that, and now we are seeing that the whole world is sort of in a rush to get a new diagnostic or to get a new vaccine or a treatment. Now, there are a lot of other diseases which don't unfortunately get this kind of attention, like tuberculosis, for instance. So I'm hoping that from this experience, we will actually realize that even the research data needs to be shared much better, both within the country as well as internationally, to allow us to develop the kinds of diagnostics and vaccines and drugs that we actually need to deal with a range of diseases. So I think that's another level at which the whole digital ecosystem becomes critical.
Okay, so it's not only about, pouring water when the fire is out there, but ensuring a preventive mechanism is also in place. That is where research comes, really important, integration of data as well. Mr. Ranganathan, where should the focus be when we talk about digital health ecosystem? Now that we have realized that these are the fault lines, these are our needs, and these are the kind of technologies, as Dr. Mohan has pointed out, AI-based systems, geographical information systems, sensing technology, and research is one area, and data integration another, pointed out by Ms. Prasad. So where should the focus be? Because this is a huge array.
True. And I think I would pick up from where Urvashi left, also by congratulating and commending the effort of Niti and the government. They released a national digital health blueprint, and this was before COVID, obviously. This, I think, this has been worked on in the last year and was released finally in January 2020. It's a brilliant document. And, the objective of this mission, hopefully, is to digitize health data at a population level. And as already said, to link and integrate health data across public and private sectors, as well as research data. Now, whereas I think this is invaluable for us to fix breaks and nicks at a systemic level, at the health system level, so that the system becomes more efficient and, we can optimize, for example, supply chain or inventory management or directories of staff that's available and research data, etc. But for an individual, we really have to see what will it do for an individual? What would be the impact? The impact would be having an electronic health record, which, by the way, is a huge thing. And it's important, but this is futuristic. And they may not appreciate it right now, or in a situation when they don't get options to access affordable medical help in the time of need. So, my thesis is that while we work on this huge digitization exercise, because it is extremely important, in parallel, we also have to quickly and urgently start legislating as well as putting in practicing telehealth, as laying out guidelines to use digital diagnostics and digital therapeutics, because this will have the on-ground impact. When you hand tools in the hand of the doctors, when a patient is able to not make that trip from a far-flung area, for example, in Bihar, to come to an AIIMS, because there is a provision where at least a virtual consultation can be made to decide what to take the further course of action on. Because obviously telehealth is not a silver bullet. Wherever a physical examination is needed, you cannot really discount the presence of a doctor to do a proper examination, but it can at least supplement what might already be available at a primary health center, or smart tools available for diagnosis, which a junior doctor or a junior nurse or a technician, for example, even at a primary healthcare level, can conduct to at least make a hypothesis of what the diagnosis could be, and then refer to the right to the right specialist, etc. So there's a huge urgency to bring solutions which will have a ground level impact.
Okay.
And the systemic impact will be taken care of by this huge exercise of digitization, which is covered in the digital health blueprint.
Okay. Urvashi, would you like to add to that, those aspects which need to be focused upon, as Sheetal is pointing out, several more can be done?
Yeah, absolutely. I think telemedicine, teleconsultation is a critical one. Just end of last month, in fact, the ministry and the Niti Aayog and the Board of Governors, which has replaced the Medical Council in the interim till we have the National Medical Commission, they've actually released a guideline, set of guidelines for telemedicine. Now, this is, of course, a very initial exercise. I think, as was being pointed out, we'll have to see how it evolves. Right now, the remit of giving the advice is very much limited to medical doctors. Now, we know we are very short of medical doctors in the country, and also not for everything do you immediately need a medical doctor to begin with. So I at least hope that as the scope goes, a little further, and we have the sort of systems in place to do the training of, different categories of health workers, do monitoring, we can actually expand it to also beyond medical doctors, because there might be certain conditions, which at least the first level of advice could be given by a nurse practitioner, for instance. The other part, I think, also, carrying forward from, what my fellow panelists just said, that is also about making everybody comfortable with using this. So that the health workers using it, for a lot of patients, it might be a new way of doing things. A lot of patients, people I've interacted with in many areas, the immediate thought process is that, we have to see a doctor straight away. So getting them comfortable that, for initial advice, it's okay. If you have somebody on the phone giving you advice, and then if you need, you can definitely see a doctor, and you should do that. So I think
training and awareness is something.
Yeah, I think it's also a behavioral change we'll have to focus on at the ground level if we really want to scale it up.
Mm-hmm. Okay, let me bring in Dr. Mohan here. Dr. Mohan, you initially pointed out how various technological tools such as AI or sensing technology as well, these are being deployed. But with the focus areas pointed out by Mr. Ranganathan there and Urvashi in terms of integration of data as well as telemedicine and training is another important part. So where do you see in terms of what we have technology-wise, and how can we build upon that to achieve this target or this dream of having a digital health ecosystem?
Yeah. The National Health Mission, partly it addresses, the points which you are raising. Mm-hmm. As per the Department of Science and Technology is concerned, our first initial objective is to know how to enable, the existing systems by supplying, type of platforms, to address this particular issue, which is, in hand now. So in that, the DST and other, government departments, we are all working together. Number one, on development of what you call the repurposing of drugs through AI-enabled systems. Mm-hmm. Okay. Now, we have various molecules available for various diseases, which is the best combination that can be identified through the AI systems and could be taken up for immediately the field trials and vaccine development. Okay. Now, in this process, probably the entire, the life cycle of drug development or the vaccine development probably will be reduced to 1/10 of the entire system. Probably maybe another 3-4 months, we will be able to, give pointers where this is the possible drug for this. So here the AI system is enabling us, to achieve that particular objective. That's number one. Mm-hmm. And number two is how the diagnostics, the process of the diagnosis can be improved further. Here the data, what she is referring about, the various data sources which is coming from various hospitals and PHCs and other, testing centers. The data needs to be integrated, brought it into a platform, and then we need to enable the researchers and other, the stakeholders to develop, the type of AI system where almost of the researchers are involved by AI, medical, and as well as the practitioners. Mm-hmm. So this will enable the quickly diagnose the diseases. Okay. Otherwise, it takes a lot of time to diagnose the disease itself. No, the machine-enabled AI diagnosis is what the second objective is. And third is how we can enable the mass diagnosis. In the sense, mass screening, for example, airports or the public places where number of people are aggregating, or the So how we can use technology to identify where there will be probably the issues. For example, if you talk about the thermal imaging scanners or the spectral imaging spectroscopy type of technologies can be brought in, how the mass screening can be done, so that immediately alert could be generated, so that we can have immediately the quarantining. So this is the immediate targets which we are working it out. The long term, yes, the people, other panelists, what we are referring, these are all like, digitalization of, health records, and then, data curation, and then bringing it to a platform, these are all, long-term plans. Yes, we have to work both short-term and as well as on the both term. So immediately we are working on the short-term goals, which I have mentioned, the 3 things.
Okay, definitely. And what we learn from the short-term goals is something which we implement in the long-term goals. Let me go back to Ms. Ranganathan and Ms. Prasad for a quick concluding comment here on the way forward, on the structured way forward here, keeping in mind the 2 aspects, that is increasing the accessibility and serviceability. Ms. Ranganathan, let's begin with you.
Okay, so concretely, I think the first thing is that we should quickly, bring out a regulation as well as clear guidelines for telehealth, so that the finite resources that we have in terms of healthcare workers are able to reach a wider population. 2, of course, as I said, digital diagnostics and therapeutics, and as Dr. Mohan rightly pointed, it is a more long-term plan, but it is as important. And 3, and I think we didn't touch on it, when we talk about digital health, it is not just about amalgamating technology with health services. It is also about developing the science, and which means so India, for example, in this entire COVID-19 crisis, has really lived up very well to its reputation of being the pharmacy of the world. We've been supplying vaccines. We've been, sending hydroxychloroquine to various countries. I think it's time we've also become the biotech mind of the world, because digital health also means really looking at digital therapies, which are going to be developed at the, at the joint efforts of technology, genetic engineering, as well as ICT and robotics. So it's really become a very large field of engineering and medicine coming together.
Okay. Urvashi?
Yeah, I think just, 3 quick points to conclude. I think one, I hope to see the National Digital Health Mission sort of rolling out quite quickly, because the concept and, all of that has been ready, because I think that will be important to just put in place the broader architecture, the broader sort of regulatory framework that we would obviously need to operate within. So I think that would be, the first. The second would be, again, as we have touched upon, sort of using these technologies to break the silos that we have in our research efforts, both within India as well as internationally, because clearly I think that's something which has become very clear from this pandemic, that we do need to accelerate a lot of our research efforts in many areas. And I think finally, not to forget the human side, the human interface when we're talking of technologies, making sure that people who are using these technologies, as well as people they are intended for, are sort of on board with it, are most comfortable using it, and it's most useful for them. So I think to also remember the, sort of the human interface of how we use these technologies, and sort of develop our training and capacity building accordingly. I think those are the 3 I would think of.
Okay, so there it is, as our panelists have pointed out, in terms of digital health ecosystem, several aspects, not only utilizing the digitech which is available to us, but also exploring it further, ensuring that there are more digital interventions as far as public health system is concerned, and harnessing the human angle, also integration of data, training, ensuring that serviceability and accessibility is taken care of. There are some short-term plans which are being acted upon, and there are some long-term plans as well, which will be acted upon. Thank you so much, Ms. Ranganathan, Ms. Prasad, and Dr. Mohan here for being with us on Rajya Sabha Television. We'll take a leave here. You keep watching Rajya Sabha Television, but also keep following all the guidelines in this fight against COVID-19. Stay home, stay safe.